Good evening, everyone, and welcome to today's session. Every day, meeting, studying together, and preparing for the NEET PG exam is the part of our daily schedule. Without meeting you all, my day does not end. So, around 50 to 60 questions. Every day we take an opportunity to do the revision. Today, we will take up around 40 questions from surgery, psychiatry, and I want all of you to download the Incus quiz app and start playing tournaments. The quiz tournaments. So let's make the great beginning. Good to see around 5 of our online classmates. Can you please punch? Can you please punch whether the voice is loud and clear for all of you? Thanks for joining with such a short notice. So that's the reason I always say, please subscribe to the channel, click on the bell notification so that every time we start the session, you will get the notification. So, doctor, let's make the great beginning. Hallucination, what is it? Typically, even without a sensory stimulus, if there is a perception in the absence of sensory stimulus, you call it as hallucination. And hallucination has the same perception like a real perception. What is insight? Insight is a patient's understanding. Oh, I have this illness. That is basically called insight. Good to see Neha after a long time. Fashida Sayeda. Wonderful, wonderful. Please inform your classmates. From now on, every day we have an hour of live online interactive class. I also encourage you to download the Incus quiz app, and there is also Incus quiz available like a website where you can play hourly quiz tournaments competing with your friends across the country. So I want Neha and many more, all your friends, to join that. And every hour there is a 20 MCQ quiz live dynamically. You can fight with your classmates on the Incus quiz app. So, doctor, insight is that awareness and attribution of the disorders and attitude towards the treatment. So, which is a mood stabilizer. Keep punching your answers, doctor. Keep punching your answers parallelly so that you are active, vibrant, and this 1 hour of time that we spend together every day, you get a good classmate from Dr. Murali Bharadwaz to sit along with you and to study. So please keep punching your answers, whatever it is. So the drug lithium is a classical established mood stabilizer. So a mood stabilizer is basically used to treat those mood disorders. Mood disorders are called bipolar, maniac, and depression. So whenever there is an intense, sustained mood shifts in a bipolar disorder, you require something to stabilize it. That's what a mood stabilizer will do. Certain atypical antipsychotics like risperidone, olanzapine, quetiapine, ziprasidone, they also have a mood stabilizing effect, is what I want to underscore to all of you. Dysthymia, what does it refer? Dysthymia is a mood disorder which is characterized by a low-grade chronic depression, is what you need to remember. So, typically for you to consider dysthymia, is there any time duration which is the part of the diagnosis? One of the favorite MCQs of examiner. So, typically any chronic depression persisting for at least 2 years, but it is less acute and severe than being labeled as a major depressive disorder, is called dysthymia, is what you need to remember. Puerperal psychosis. Let me check. Neha, what is your answer for this question? Puerperal psychosis, when will it have an onset? Within how much period of time it will have an onset? I'm waiting for Neha and Fashida's answer. Neha is betting on 6 months. Okay? That's good. Now, 2 weeks of childbirth. Puerperal psychosis has an onset within 2 weeks. So, usually the postpartum after the delivery, the laboring mother who delivered the baby, she will suffer from a psychosis in the first 3 weeks following the delivery, is what you have to emphatically remember. Now, among all these imaging modalities, what is the correct match? You should know for every investigation you do, what is the radiation dosage? This is one of the favorite MCQ of the examiner. If you are doing head CT, 1.5 millisieverts. Screening mammography, 3 millisieverts. Chest CT, nowadays, left and right we are doing chest CT scans because of the COVID. Every surgeon before posting the patient for surgery is doing a CT scan. You don't know what is the impact of that on the chance of developing radiation-induced cancers for a period of time. It will only be known after a couple of decades. The chest CT, 5.8 millisieverts is what you need to remember. So I leave this literature for you, doctor. एक paper ले लो, pen ले लो, लिख लो, और याद रखो, because this is the favorite question of the examiner. Okay? जो बट्टी मारने का चीजें होते हैं, बट्टी मारना ही पड़ेगा. There is no other way. There is no other. If you cry, buy a new pillow, bury your head inside it and cry. Oh my God, so many things to remember. Yes, there is no other way. But be focused. What is so frequently asked? What is being emphasized in our learning videos on the onlinemmbbs.com? जब भी जो बट्टी डेफिनेटली मारना है, मैं आपको बताऊंगा, आप ध्यान से उसको कैसा भी बाय हार्ट करके कल के एग्जाम में रिप्रेजेंट करना पड़ेगा. So what is wrong about radioactivity? The SI unit of radioactive decay is becquerel. 1 becquerel is defined as 1 transformation per second. Curie is equal to the activity of any radionuclide decaying with a disintegration rate of around 3.7 to 10 to the power of 10 becquerels is what you need to remember. Can you stop the gamma rays with a sheet of paper? What is the penetration power? Gamma rays require a thick lead sheet is what you need to remember. So 1 becquerel is decay per second. Another unit of radioactivity is Curie. Curie was originally defined as the activity of 1 gram of pure radium isotope, that is radium-226. Now, if you put a sheet of paper, alpha particles can be completely stopped. Beta particles, you have to use aluminum shielding. Gamma rays, you have to use very thick layer of lead is what you have to basically remember. Come on, shoot your answer. Neha, what is your answer? What is wrong about Cobalt-60? Let me see your answers. Fashiha Sayeda, Neha, let me check your answer. What is wrong about Cobalt-60? Yes, Cobalt-60. I'm just waiting for your answer. Good. Neha is betting on option C. Let us see. Computer Mahodai, what is the correct answer? Neha ji, आपने जरा 1 centimeter में clean bold हो गया. So Cobalt-60 has a short life of 5.27 years. True. Because of the short life, you can't find it in the nature. Very important. And the cobalt decays by negative beta decay to the stable isotope nickel-60. And Cobalt-60 is a radiation source for the medical radiotherapy is what you need to remember. So once more. Very good. Fasiha Syed rightly said. Now, doctor, where do you use the cobalt? Sterilization of medical equipment as a radiation source for the medical radiotherapy, for the industrial radiography, etc., etc. Now, what is wrong about radiation? Infrared is a non-ionizing radiation. Please don't forget. Once more, there is a small table है जिसमें आयोनाइजिंग नॉन आयोनाइजिंग रेडिएशन क्या क्या होता है हर एक बुक में मिल जाएगा आपको, मगर यहाँ के बुक में बैठना है, दिमाग बोल के एक बुक दिया ना गॉड ने, वहां बैठ जाना. नॉन आयोनाइजिंग रेडिएशन can lead to injury because of local heat production. Then whenever the living cells receive the ionizing radiation, there can be a damage to the DNA. So whenever there is a decay of radium into radon gas, then that emits the alpha radiation. Once more, which radionuclides are alpha, which are beta, which are gamma, which are alpha and gamma, which are beta and gamma? Oh my God. Preparation for entrance is always tiring. Now, giant cell tumor. Most of the giant cell tumors, they occur in the long bones. They occur in the long bones. And most of the tumors, giant cell tumors are all eccentric and they are typically subarticular in their location. There is a narrow zone of transition with the lack of sclerosis at its margins is a distinctive finding of the giant cell tumor is what you need to remember. But where are these giant cell tumors located? They are located around the knee joint is what you need to remember. It's not the elbow. That's the most important point you need to understand. Around the knee joint. So this is how a giant cell tumor around the knee joint is what you should understand. Now, yes. With regard to the pre-operative management, the medical conditions that affect the surgery is a favorite question of the examiner. So you should remember that patients who have a diastolic pressure more than 95 millimeters of mercury, they should have their elective operation postponed. But now comes an important question. Dr. Saab, हमारे श्रीमती को recently MI हुआ डॉक्टर साहब, अभी उसको हिस्टेक्टमी कराना है, करा सकते नहीं करा सकते बोल के पूछेगा पेशेंट. So for how long you should delay an elective surgery? So you should remember, typically within 3 months after EMI, most of a good number of anesthetic agents will lead to the release of catecholamine. So that is the reason elective surgery should be delayed at least 6 months is what you need to remember. So why you don't want to inject bupivacaine intravenously? Because bupivacaine is a very, very cardiotoxic agent is what you need to remember. That's the reason bupivacaine should not be used for intravenous regional anesthesia. Bias block, you should not. So I strongly advise all of you, please download Incus Quiz app. Morning 8 a.m. to night 12:30 p.m. Every hourly there is a quiz tournament. खेलते जाना आपके साथियों के साथ. So after every question, you will be getting the leaderboard of everybody who are playing the tournament. And 20 questions you will answer in about 10 minutes. But that gives you the required booster to go back to the books and study. And every day I promise to spend an hour with all of you to add that extra petrol. So एक petrol होता है हर एक घंटा एक quiz tournament with your friends across the day on the Incus quiz app. Another petrol होता है Dr. Murali Bharadwaz 1 hour will spend time with you every day. On the top of it, you also have onlinembbs.com video library, online grant tests, everything. But everything is not enough. You need to get self-motivated. First important thing, don't get depressed. अरे मैंने ये टाइम बर्बाद किया, वो टाइम बर्बाद किया. हम सब टाइम बर्बाद करते 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 यहाँ तक पहुंचा. There is nobody who will be able to study 18 hours a day unless they have a catatonic schizophrenia. So that is the reason, don't get disappointed when timetables do not work. What is important is, एक दो अच्छा साथी रहना साथ में, उसके साथ मिलजुल के आप पढ़ाई करना most important है. Patients vary greatly in their post-operative analysis here. What is the best way to assess the adequacy of the pain relief? The best way is ask the patient to measure the pain. So you can use a analog score where a mark is placed on a 10 centimeter line. अगर कुछ भी दर्द नहीं है तो एक एंड है, वर्स्ट पेन अदर एंड है, बीच में कहाँ है बेटा बोल के पूछ सकते. That's called pain analog score is what you need to remember. Starvation. The cerebral energy metabolism requirement is around 100 grams per day of glucose. Mobilization of the fat is dependent on the एकदम आप starvation हो रहे हैं तो hypoglycemia होता है. Hypoglycemia will decrease the insulin levels. And all of you know insulin is a lipolytic hormone. Then lipogenic hormone. So if once insulin is not there, there is a lipolysis. So mobilization of fat automatically happens when you are starving. Starvation leads to hypoglycemia decreases insulin. If no insulin, then there is a lipolysis is what you need to remember. When will glycogenolysis will be the significant contributor of the energy in a starving individual? In the first 2 to 3 days. No, wrong. It is in the first 24 hours by mobilizing the glycogen stores is what you need to remember. A 67-year-old female is referred for total parenteral nutrition after a total colostomy. Now, what is a marker that suggests malnutrition? Transthyretin. So there is a malnutrition universal screening tool, must, for the adults. So, albumin versus transthyretin. You can also use albumin as a measure, transthyretin also. Now, with regard to the water homeostasis, 2/3 of the total body water is intracellular. Average adult has around 3 liters of plasma. Water moves freely across the cell membranes, which is also true. But what is the total body water of an adult male? 60% of the body weight. That is, अगर 70 kg का आदमी है तो 60% होता है 42 liters of our body होता है total body water. Is what you need to remember. Out of this 42 liters, 23 liters is intracellular, 3 liters is plasma volume, remaining 16 liters is interstitial fluid, is what you need to remember. 0.9% normal saline. So basically, it has a equimolar concentration of sodium and chloride. The normal saline has 154 millimoles of sodium and chloride. So this value is very, very important. Keep punching the answers, doctor. When do you want to administer dextrose? Whenever a clinical situation, purely you want to replace water, then dextrose solution है तो dextrose metabolize हो जाएगा. जो भी water उसके साथ दिया, that will help the person. And there is no electrolyte load. So that is typically done whenever a patient has a hypernatraemic dehydration. To treat that, you need to go pure water. So that is possible by giving a dextrose solution, which does not have any electrolytes, is what you need to remember. With regard to bowel resection, whenever there is a high output fistula, the sodium content is around 90 millimoles per liter. And short bowel syndrome typically leads to peptic ulceration. And if you do bowel resection, oxalate stones are very common. Now the question comes, when do you want to do jejunostomy? What is an indication for jejunostomy? Whenever more than 200 centimeters of the bowel is being resected, that becomes an indication for jejunostomy. Now, let us talk a bit about the skin wounds, etc., etc. So, typically, the skin wound edges should not be closed very tightly. You can put a glue to approximate tissues. To do a vascular anastomosis, by chance you are operating, a vessel is being cut, then non-absorbable suture should be used to do vascular anastomosis. So whenever you do a colonic carcinoma resection, for example, you want to bring the both ends of the bowel together. How do you do the anastomosis of the bowel? Not always single layer. One method is single layer interrupted extramucosal anastomosis. That will lead to least tissue necrosis or luminal narrowing. You can also do two-layer closure. The inner is a continuous all-layer suture and it is supplemented by inverting the seromuscular second layer of the suture on the outside. So both the ways you can be able to do. But whenever you do vascular anastomosis, it is non-absorbable suture is what you need to remember. Now, the various types of needles Surgical instruments, one of the favorite questions. So you should remember cutting needles for the skin and aponeurosis. Needles with a loop suture for the laparotomy closure. And in arterial suturing, you use double-ended needle sutures. So that is what you need to remember. So the round-bodied needles, they are the ones which are used for the closure of the laparotomy wounds is what you need to remember. So doctor, this is a round-bodied, this is a cutting, this is a reversed cutting. All these things are going to come in the tomorrow's NEET PG exam as image-based questions. Okay? So typically if you go to Incus quiz app, once more I want to tell you all to go to Incus quiz app. I will try to give you the link. I'll give you the link of, we also have a web-based Incus quiz app. Yeah, I'm trying to post yeah. Yeah, I'm posting you one link, doctor. Please go to this link and yes. Let me quickly show you. Once you click on the uh, Incus quiz app, the link that I have shown you, you will land in this place, doctor, of Incus. This is the counterpart of our mobile app. So once you go here, you need to log in with a Google. You can do the registration on either the Android app or iOS app, doesn't matter. So you can access on either your iPhone or on Android phone or on the web app, anywhere you can with the same Google ID. So once you come here, you have all exams. So here you have the NEET PG exam. So you have the upcoming tournaments. For example, you have a tournament at 8 o'clock, another 10 minutes for the medicine quiz. Then at 9 o'clock, you have surgery quiz. After that, you have obstetrics quiz at 9:30. There is an image-based quiz at 10 o'clock. Then you have at 10:30 anesthesia quiz. Then you have at 11 o'clock dermatology quiz. Then you have at 11:30 psychiatric quiz. So like this from morning 8 a.m. to night 12:30, every hourly you have a quiz. But to play the quiz, you have to register. The moment you register, it will take you already around 7 players registered. It will take you to a screen like this, where it will be showing you the time basically, within how much time the quiz is going to start, right? So you need to be there inside the room at least 10 seconds before the start of the quiz. If you come, even if you are not there 10 seconds before the quiz starts, you will be not able to enter the quiz. So this is how the Incus quiz app, you can be able to play the games. Then if you miss the game, don't worry. You have the game, the moment the scheduled time is over, it will move into autoplay. Like there's a pediatrics quiz. It was conducted at just before now, 7 o'clock. Around 5 players are there. It moves into autoplay. Then there was an orthopedics quiz evening today, 6 o'clock. It was played. It is available. Now you can play. So you can always play by clicking on autoplay. So once you click on autoplay, it will take you to the game. So every question has 20 seconds of time. It will compare your answer. For example, I answered alpha thalassemia. So I correctly answered. So I got 1000 marks. But I took more than 10 seconds to answer. So that is the reason I get 0 bonus. And there will be a leaderboard. Chaitanya, Banod, Sandeep, they both played before me. So even though they played before me, when I am auto playing, my performance is compared to all of them. Okay, so there are 600 quiz tournaments covering 12,000 questions every month for you for a small price of 600 rupees subscription per month. So take every opportunity. Whenever I get time, I will try to join and play along with all of you a live quiz tournament, right? So that is my deal to all of you. But otherwise, you can always play. You can tell your friend, hey, let's both play this particular quiz, then get into the quiz and then play with your friends. So anything you can do on the Incus quiz tournament app. So don't forget, today only subscribe yourself to the Incus quiz app. So that is all the story. Now, doctor, let's so my job is not anything about teaching, you're all good. Only thing is you need to get practice, you need to get inspiration, you need to get the drive. Today learning is very easy. So that is the reason we decided every hourly we give you a quiz tournament to inspire your preparation, which is much more a holy job that we will be able to do for all of you. So today only download the app or go to the Incus quiz web app and then subscribe yourself and then start playing the quiz tournaments and get inspired every hour. So doctor, Now, with regard to the blood pressure in shock, you should remember elderly patients who are normally hypertensive may present with normal blood pressure. Normal blood pressure. Then the children and fit young adults, they are able to maintain a blood pressure until the final stages of the shock. Finally, what is death, doctor? When you watch a dying person, it is the heart electrical activity coming to a standstill is the death, right? So if you take children and fit young people, they maintain the blood pressure until final stages of shock. Beta blockers may prevent tachycardic response. Whenever shock is there, we get a sympathetic activity and tachycardia. But somebody is regularly receiving beta blockers, then they may not get that tachycardic effect. Is very important. Hypertension is not an early feature because we have a lot of hemodynamic homeostatic mechanisms. Hypertension is only seen after the late stage of the shock is what you need to remember. With regard to the reactionary hemorrhage, it can be significant, requiring re-exploration. It occurs within 24 hours operation. And why reactionary hemorrhage occur? Because of the dislodgement of a clot, slipping of a ligature, that is the responsible. With regard to the blood transfusion, whenever there is any coagulopathy, like a disseminated intravascular coagulation, fresh frozen plasma is the first line therapy. Cryoprecipitate usually has a low fibrinogen and low factor VIII. In those people, a fibrinogenemia or factor VIII deficiency, for them you can use the cryoprecipitate because it is very rich in it is very rich in fibrinogen and factor VIII. And if a patient wants an autologous transfusion before surgery, he can pre-donate the blood up to 3 weeks before the surgery. And the platelets have very short half-life, 5 days only, compared with RBCs. RBCs, when you store them at 4 degrees Celsius, they have a shelf life of 35 days. So once more, all this transfusion funda, one of the favorite topic of the examiner. Now, the wound that occurs whenever the skin and subcutaneous tissue is being stripped from the underlying fascia by avulsion, what do you call it as? We call it as a deglobing injury, is what you should remember. Cellulitis, commonly called by Clostridium, blood culture is usually negative. It is poorly localized, but it is more diffuse, unlike an abscess, is what you need to remember. And cellulitis can lead to systemic inflammatory response with chills, fevers, rigors, etc., etc. Whenever you do a gastric surgery, biliary surgery, how do you like to call that as? You call it as a clean, contaminated surgery, is what you need to remember. Once more, the classification of the wounds into clean, contaminated, dirty, everything you should know the definitions. Hydrated cyst. If you use colloidal solutions, most of the times they're all sclerosing agents that can lead to sclerosing cholangitis is more common, especially in multiloculated hydrated cysts. If there is a small deep cyst which is showing calcification, you can watch and treat with albendazole. But if the cyst happen to rupture, it will release a lot of daughter cysts, and that can lead to dissemination of the hydrated, is what you need to remember. Mycobacterium tuberculosis of the gut. Always remember, TB, how is T? T is transverse. So, transverse ulcers with undermined edges, typically in the ileum, that's how you describe it. There is a terminal ileal hyperplasia and thickening, lot of tubercles on the serosal aspect of the intestine. They're all true about TB. Where do you see apple core lesions, doctor? We see it in case of carcinoma colon, is what you have to appreciate. With regard to the amoebic abscess, you can do medical management with metronidazole, indazole. If there is any signs of imminent rupture, aspiration should be carried out. And whenever there is any ruptured liver abscess, then surgical treatment is indicated. But the primary treatment, most effective treatment for amoebic liver abscess is often medical, is what you need to remember. Now, what is the definition of a neonate? Neonate is up to 4 weeks. And the urinary bladder is an intra-abdominal, not a pelvic organ in infants and children. And if you look at the infant's head, it accounts for 20% of the body surface area. Some of you are going to do MD pediatrics and become DM neonatology from PGH Chandigarh All India Institute, some of the great places to do post-graduation. So live in that dream, sleep in that dream, wake in that dream, breathe in that dream that you are going to become the topper in the NEET PG. That's the only way you should live the next 75 days to become the topper. Now, if you look at the newborn, their ability to do gluconeogenesis is very much impaired. That is the reason they often go into hypoglycemia. Dynamic intestinal obstruction, paralytic ileus, mesenteric muscular occlusion, pseudo obstruction, they're all the classical examples. Whereas addiction is not dynamic. So once more you should know dynamic, adynamic, paralyticus ileus. Now, familial adenomatous polyposis. So you need to do a colectomy with ileorectal anastomosis, but that can lead to a rectal cancer later, even after you have done. And 15 to 20 years after the onset of the FAP, large bowel cancer occur. And even at 30th year, if there is no polyp, then FAP is unlikely, because in FAP, polyps appear even before the age of 30 years. And familial adenomatous polyposis, 100% association with cancer. That's what you need to remember. Now, pseudocysts, let's talk about them. Often pseudocyst is confused with a cystic neoplasm of the pancreas. And typically when somebody had an upper abdominal trauma, blunt trauma, that also can lead to a pseudocyst. Into the pseudocyst, there can be a bleeding that can occur because the stomach's inner part and the pseudocyst of pancreas are very close to each other. That is the reason as a part of treatment we do cystogastrostomy. But when will pseudocysts occur? It usually takes around 4 weeks or more for the pseudocyst to develop after acute pancreatitis. Now, you want to know the severity of acute pancreatitis in Glasgow score or Ranson score. What are the parameters? Age, WBC count, serum calcium, but not serum amylase. This is one of the favorite MCQ in the exam. Amylase is used to diagnose pancreatitis, but it is not the part of the Ranson's criteria, is what you should remember. With regard to the cholecystectomy, what is a true statement? So, Kellogg's triangle dissection, it can be hazardous when there is a Murali syndrome. The fundus first approach is good whenever open operations are very difficult. And post-op cholecystectomy syndrome occurs in about 15% of patients. Routinely, we don't do preoperative cholangiogram. And what is the Murali syndrome, doctor? Any stone ulcerating through and into the bile duct is called Murali. And whenever you are suspecting Murali, then the infundibulum of the gallbladder should be opened and the stone is removed and the infundibulum is oversewn back, is what you need to remember. With regard to the gallstones, 90% of the patients with acute cholecystitis, they all responded to conservative treatment. Yes, that's a true statement. So it is always safe whenever a symptomatic gallstone is there to observe the patient. You need to do prophylactic cholecystectomy only in diabetic patients or those who have a congenital hemolytic anemia. Similarly, those who are undergoing surgery for morbid obesity. There are few scenarios where you need to do prophylactic cholecystectomy. Then what are the etiological factors that lead to acute acalculous cholecystitis? Those who are recovering from major surgery, trauma, burns, multi-organ failure, in those people, acute acalculous cholecystitis is particularly seen. Now, typically, whenever there is a blunt trauma can lead to renal injury, splenic injury, mesenteric injury, and penetrating trauma can lead to chest injury, pericardial injury. So, liver injuries are very rare because liver is very well protected under the right dome of the diaphragm. That's the reason, if liver is damaged, the overall injury will be very serious. That's the point you need to appreciate. CCT you don't do in every case of liver injury. But if the patient is unstable, the patients need to be taken to the theater without sending him to radiology. Because liver is injured if you are suspecting, means you have to explore. Otherwise, it is the most serious injury, most serious form of blood trauma is what you need to remember. Now, with regard to the gastric cancer. So, gastric cancer, once you do resection, how do you maintain the GI? How do you manage post-operatively? Radiotherapy to the gastric bed is considered to be a very good adjunctive therapy. D2 gastrectomy, D1 gastrectomy. So what is D2? En bloc resection. If you are doing all those surrounding the second tier of lymph nodes, it's called the D2 gastrectomy. It is much more superior than D1, where only perigastric lymph nodes are only removed. That's the point. Now coming to the peptic ulceration, once upon a time they used to do jejunostomy and all that. Today the main treatment is proton pump inhibitors. So medical management is the main form of treatment. And we use eradication therapy, H. pylori. To all patients routinely, we assume that Helicobacter pylori and then treat it. And why late dumping syndrome occur? Because once you have done gastrectomy, there is a reactive hypoglycemia. Whereas early dumping is because of sudden increase in osmotic fluid. So once more, you need to go back to the online MBBS video library and do a revision. एक table होता है, early dumping, late dumping syndrome, what are the differences, along with your classmates. So whenever duodenal ulcer is perforated, there is no need of taking biopsy of ulcer margins. Unlike in gastric ulcer, only gastric ulcer has a tendency to turn out to be a malignancy, not duodenal ulcer. Now with regard to the burst abdomen, when does it occur? It typically occurs from 6th day to 8th day is what you have to remember. So doctor, with that, आज का चाय पे चर्चा with Dr. Murali Bharadwaz comes to an end. I wish you all a high energy, full of inspiration, no depression, no thinking about yesterday, no worry about tomorrow. What we need to do is we need to live today is the best day. इसलिए मेरे प्यारे साथियों, get up, have your dinner, have a jog, go back to reading room, open up onlineMBBS.com video library and do a revision. Play the quiz tournaments hourly on the Incus quiz app, and then with 2 to 3 friends, next 75 days, give the best of yourself, and God gives you that strength to become the topper in the NEET PG. Good night and a great time. We will once more meet tomorrow. Thank you.